obviously, the report was from Uttar Pradesh. Tamil Nadu, some would argue, has a much better ground level backbone of delivering public health. But at the same time, so the numbers seem huge, because if you're going to continue to do routine immunization, and on top of that, you're scaling up to do coronavirus vaccines, that's almost 14 to 15 times as many. Isn't that going to be tough?
Definitely, these are all tough targets for us. But frankly, if you look at, they have given a very clear communications. They have been giving. We have got a national committee which is guiding us,
okay.
And we have 3-level committees. You have a state-level committee at the level of chief secretary, and one at the level of the secretary health, and then district and block committees. So we have to plan. Instead of looking at it a whole number, if you break it up and say that the first target is going to be the frontline worker, then health worker and the frontline worker, then people above the age of 50 and those with comorbidity. The real challenge will come only with the when we come to the general population.
Yes.
Already states like Tamil Nadu, based on almost 7 to 8 communications government of India has given, we have developed additional walk-in coolers in 51 places where we can store them. Then we have augmented the facilities with regard to the cold chain points, the next points, around 2,688
You've
points.
You've already started doing that.
Now we are looking at the logistics. It's not just the number and the place where we have to store, but also develop the vaccinators and ensure that ultimately we have to look at 47,000 points where we'll have to do.
47,000
was perhaps the other example where that number
47,000 points
when we used to do. So it's an ongoing exercise. But we are continuously in touch with Government of India. Based on their advice, we are bringing back issues to them where we will get these vaccines, how many numbers, at what frequency. Accordingly, we are developing. And they've also given, we have to look at a site, maybe 100 at a point. Vaccinators we have to train, and the number of people. So it's basically
quite
a very
challenging
complicated exercise. It's a very
it's quite challenging
kind of thing where we are in constant touch with
let me just go to
officials and the officials in the health ministry.
Right.
And the state is also constantly continuing meeting with the district officials on that.
Okay. It's quite challenging. Let me just come back to you in a second.
And also various campaigns will stand in good stead. Having said that, we have to constantly keep looking at the challenges which I think the UP example has shown.